Apart from being very, very angry, now I went to St George's. I got there at 2 o'clock. She looked in both ears, clogged up with wax.
Right.
So she said, you have to see the doctor in order to get syringed.
Right.
3:25, I was rather miffed because I was still sitting there.
So I guess what's happened is you left without your hearing test.
I
And you
left
came the
it.
other day to get your ears syringed and there was a problem there. And so your ears are still filled with wax and I'm going to need to refer you again to get them sorted out. Is that right? Is that where we're going with this story?
More or less,
Yeah,
yes.
okay,
But
fine.
the thing is, I'm absolutely furious.
Let's have a look at the ears now. So what were you coming to tell me today just about this story? Was there anything new?
Well, actually, I was coming here, hopefully with clean ears, in order to make another referral. Because I came to the conclusion, that referral you done the last time.
So I've done several referrals for this. I really understand with Ian why he was so frustrated at being kept waiting at his hospital appointment. The problem is that all the clinics and services are really overused and oversubscribed. And so inevitably there are delays in treatment. Sometimes I think people forget that. People will get the care that they need, but often it may not be as smooth as they'd hope.
But at the same time, I'm not impressed by these olive oil drips because every time I put the cotton wool in and take it out just before going to bed, it's just the staining of the olive oil.
So the reason we get you to use the drops is hopefully it will encourage it to come out, but if not, it softens it, so it will make it a lot less painful for you to have that wax removed. So I know it's a bit of a nuisance having it done, but similarly, it needs to be done for us to get the wax out.
Yeah, I understand that. What I was thinking, though, is like going back to an old and tested method which worked, was getting the olive oil, not the drops, heat it, and then pour it in, and then put in the cotton wool, because the heat from the olive oil going in is going to melt it a lot quicker than cold olive oil.
But it will also damage the skin in the ear. So I wouldn't heat up oil and put it in your ear. I think that would be a disaster.
I'm not saying it's going to be boiling. It's
you'd warm it, but
just warm it.
Yeah, I probably wouldn't do that, Ian. If it were my ears, I definitely wouldn't. Had you just sat there a bit longer at the clinic, you probably would have wax-free ears now. I know it's a nuisance when you're there, but it's just delayed things for you anyway.
I've got other things to do rather than sit around waiting.
I do get that, Ian, but at the same time, you're going to not have your hearing so well for the next couple of months while we get this sorted.
Nothing unusual then, is it?
Okay, right, all done.
Is it?
Yeah.
Right. I will sort that out.
Okay.
Bye.
Bye.
So anyway, how are you getting on?
Well, I'd like to ask you a question, whether you can answer it or not, I don't know. And that's the nicotine, I think, from smoking has lodged in my arteries.
It's not the nicotine that's doing that to you. It's all the rest of the rubbish that's in a cigarette and chemicals.
Yeah, it's a fine dust, basically, isn't it, smoke?
Yeah, well, it's killing you. And that's what's going through your arteries. How many cigarettes have you smoked since you saw me Thursday?
4, 8, about 12.
Okay, so I thought you were going to use the patches and the gum and not smoke. That was the idea of this.
Well, I did, but I cannot resist.
So you're still craving for cigarettes. So then the regime that I put you on is not high enough. You've got a 4 milligram gum. Have you been using the gum?
Well, I don't like to criticise it, but it's inclined, I think, to give me like indigestion.
Yeah, it does. It can do. It can do.
You know about that, okay.
How about a lozenge? I tried to try a lozenge instead. So what you do is you suck it and you park it, you suck it and park it, and you keep doing that.
What flavour are they?
Mint.
Oh, yeah.
Is that all right?
Yeah, that's fine. Very limited on that, I expect.
Oh, there's not a lot of choice, I'm afraid.
No.
Okay.
I'm not being picky.
Okay.
I'd like to try them if I can.
Okay, and I'm going to up the patches, so 5 extra milligrams in it, and we'll see if that regime helps then.
Okay.
So, are you going to come back and see me next week?
I have to check my diary.
Okay, well, I'll make a new appointment because you need to see me. This is something you need to come back and see me for.
Okay.
All right?
Yeah.
How are you?
Well, about 5 weeks ago, I was staying with my daughter down in Somerset. I got sunburned on my forehead. Well, it's now spread all over my face and my arms. The skin.
Quite dramatic, isn't it?
Yes.
Much, much worse than that. You must take off your jacket. I'm going to fill you in as to what occurred.
So 5 weeks ago it started?
That was the start of it,
The start.
yes.
But this terrible pain that he's had on the shoulder. Now you'll have to just look at this bruising.
Oh, wow.
It's terrible bruising I've ever seen.
And no other reason?
No, I don't remember.
falling,
I mean,
no
you know, I
injury, no
occasionally
knocking.
bang myself and don't notice, but I'm used to the fact that I bruise very easily.
Yes. A blood vessel must have been injured at some point somewhere. And that obviously normally happens from knocking it.
Right. Well, I might have knocked it because I don't notice, you see, because I'm so used to bruising that if I just bang against
No, but
it...
it's never been like that before.
No, it hasn't.
It would have to be quite a big knock. So if
You
it's
would have
not
noticed
that, then it could have been one of your superficial veins here might have by itself just popped.
Right.
And then just in your case, it's just made a much bigger bleed come up here. So I think that's probably the more likely thing because you would have felt the pain of knocking
Right.
it to cause this.
But that's the shoulder. But this is, at the moment, the worst thing is...
The redness. Yeah, that skin is just irritated so badly. Don't know what
Yes.
you know.
Is that psoriasis?
No, it's not. This is the sun. This is a overreaction.
Really?
It's a photosensitivity reaction.
Really? Are you sure?
It can be because of different things. So it can be because the skin is made sensitive by something else.
Well, I do have a very sensitive skin, I know that.
So it's definitely not psoriasis.
No. Psoriasis comes in patches. The thing we want to turn this reaction off is a steroid cream. And in your case, we might need 2. One for the arms.
Yes.
Anything below your neck is going to be a stronger one, and on your scalp and your face will be a milder one.
Right.
And what about the swelling on his hands?
This is linked in with this sun reaction rash.
I'm absolutely
It can be
amazed
dramatic.
at that.
It can be dramatic.
So really, he must never, ever go in the sun.
Ever again.
What you must do is, if you go in the sun, you must wear factor 50
Right.
on the areas that are exposed to
So
sun.
no more trips to
and a
Ibiza.
hat. No more trips to Ibiza. All
Thank
right?
you for being so thorough.
No problem.
Anyway, lovely to see you, Dr. Sharp.
Yes, thank you very much indeed.
Bye-bye. See you.
Okay. And Miss Moore, how are you feeling?
Not good, Doctor.
No. Lots of problems throughout the tummy. Is there?
All round here. All this. Oh, it feels like I'm on fire.
Okay.
I tried to have some soup yesterday.
Yeah.
4 spoons, that was it.
Yeah.
I put the rest back into the fridge.
Okay.
I've got no desire.
Yeah.
I've got no desire to eat, and I'm tired of the pain. I'm fed up with it.
Did they talk to you when they did the endoscopy? Did the man that did the endoscopy talk to you about what they saw?
No, they just told me, they said a slight tear in the small intestine.
Okay.
I've got nothing for praise for those people.
Indeed.
They're very good.
Remember when we said that we were making the referral very urgently because we wanted to know what was going on with this symptom? That there's always the possibility of a cancer or something like that in the stomach.
Yes.
It did show something like that. It wasn't the typical sort of cancer that you see in the stomach. It was something else. It was a type of lymphoma. Okay. On the plus side, it's not one of the very aggressive things that happens. So I think that's the most important thing to think about at the moment.
Yeah.
Okay.
Whatever comes my way, comes my way. I knew this was a year for me.
Yeah.
I knew this was. I knew.
In what way?
This was the very year back in 1980 when my dad was my age now, 59, that he passed on. And now I'm 59.
Okay.
And I thought there was something in this.
Yeah. This type of cancer in your stomach isn't one that typically is very aggressive or anything like that.
But it is a cancer.
It is a type of cancer, yes.
Ah, right, right.
Okay.
I don't think they'll ever see me in work again now.
Okay, well, don't worry about work at the moment. Put that to the back of your mind. Okay? Let's focus on what's happening at the moment and what's going to happen next. So we got the letter from... Let me show you the letter from the hospital.
Yeah.
So...
I'll let you read it out, Doctor.
Yeah.
I can't look at the screen.
You take your time. Do you want a glass of water or anything?
I'll have a glass of water, please. Thank
Let me
you.
get you a glass of water. Just take a second. I'll be back in a moment.
Thank you.
There we go.
Thank you, Doctor.
No worries. I think it's difficult talking about these things as the general practitioner and not the hospital doctor because we don't have as much knowledge with the specific points around this.
Yeah.
But it's worth us talking about this today.
Yeah.
And then we can, be here to support you over the next weeks and months.
I mean, I've got to the point now where I don't really care.
Yeah. This is, as I say, it's not one of these very aggressive cancers. So it's not something that somebody needs to, go in and cut it out straight away or anything like that.
Oh no, not under the knife.
Nothing like that. Nothing like that. Okay. Take your time.
I've had illnesses before and I've had colds and things and I've got over everything. But I'm not getting over this one.
No, this is one that you can get over. So this is not one of the very worrying types of cancer. So this is one of the things that is often very localised. It's very slow changing. And there are lots of treatment options for it. After a patient hears the word cancer in a consultation, they're not going to take on board much of what you're saying. It's obviously beneficial to try and provide some information about what might happen next, but we just know that at that point in time, they're not going to take on board much of what we're saying. Obviously, one of the great things about general practice is that we are there later that day, we're there tomorrow, the next day, and that we're easily accessible.
If the worst comes to the worst, with this, as John Wayne said,
Yeah.
the big C,
Yeah.
to quote, how long would it take to happen for me to,
No, it's not one of those things to think about at all at the moment. Obviously, these things go through your mind.
I'd rather know.
So this type
Because
of
I'm not feared of it.
Yeah. This type of cancer's very treatable. The problem with cancer is that it very much does feel like one condition, that this is cancer and it's terminal and this is the end of my life. Whereas in truth, there is so much variations between cancers, how early they're picked up, the types of cancer, that it becomes much more difficult to understand. And as soon as we use words like cancer, patients unfortunately always fear the worst.
I'm not going to drag myself all the way through this for a long period of time. As long as I know what is what, that's good.
Yeah.
Because I can prepare myself.
The difficulty is there's a lot of differences between each type of cancer. And therefore there's a lot of differences in outcome. Some cancers are very slow changing.
I'm not going to bleeding go through a long suffering process and whatnot, because I will tell you now straight.
Yeah.
I will tell you now. I'll make myself a cocktail, right? And I will go out overnight.
Okay.
I promise you. That's what I will do. Oh yeah. Huh. Make no mistake.
It's Maureen. Come on.
I don't want to waste anybody's time here.
You don't waste anybody's time. We're here for you. And we're, as I say, our door's always open. You can give me a call at any time when
Yes.
we're here.
Yes.
And I would always see you at short notice. What I want to suggest now is that it would be useful if you came back at lunchtime and then we had a chance, you know, if you've got any more
Today?
questions. Yeah.
Yes, I can make it.
Between now and then, I will have spoken to the consultant, and then we'll have a bit of a plan, and then we can get things going forwards together.
Okay then, Doctor Ed.
Okay.
If anything happens to me, in the meantime or anything like that, please give my regards to Dr. Shard.
We're not thinking like this. We're not thinking. It's just.
Please give my regards to him.
Oh, come back and talk to me at 1 o'clock, and we'll have a bit more of a discussion about things, and we'll try and put things into more perspective.
Yeah.
At the moment, it's, you know, the more I talk, the less you'll take on board.
Yeah, I'll be in it then. I'll be in on time.
Yeah. Take some time. Come back in at 1 o'clock.
I will.
And I'll see you then.
I will, Dr. Ed.
Okay.
Thank you very much for your time and your concern.
No, not a problem at all,
appreciate
Mr. Roy. You know, these are the most important times.
Thank
and
you,
that's
Dr.
why
Ed.
that's why we're here.
Thank you.
But
and if you see Dr. Shard, give him my regards.
I'll send you a regard. Pop in and see me at 1 o'clock.
I will do.
And we'll talk further.
I'll be here. I'll be
Okay.
here about 10 to 1.
Okay. See you then. Take care.
Thank you. Thank you.
Take care.
I'll see you soon. Thank you.
Indeed. See you then.
Hi, Mark. I'm okay. How are you?
Yeah, right, not bad, thanks. Yeah.
Yeah?
Okay, yeah.
Okay.
Yeah. Well, I had my first CBT appointment for 8 months, I think, last week. So just sort of tweaked a few things that I was doing.
Okay.
So I'm just going to try and go to bed at 11 every night, and might cut out all alcohol, which I've been doing last week.
Mark has suffered with anxiety and depression since about 2012, 2013. He'd previously presented to his GP initially with just tiredness, but then he developed more depressive symptoms and was diagnosed with depression.
Also, I've been keeping like a sleep diary and activity diary.
Yeah.
Like a food and exercise journal as well. And just noting on it when I feel tired and how I feel, what thoughts are running through my head, and that sort of thing.
Yeah.
Feeling a little bit better, but sort of mood sort of up and down still, which seems to be, I don't know, I thought I'd sort of, that had improved before, but it seems to still be sort of getting the sort of bit down and sort of suicidal thoughts and things.
How are you managing with the suicidal thoughts? What thoughts are going through your head?
Yeah, just feeling quite down and a bit dejected, I suppose, and just, just thoughts about ending it all and how I do it. But, I suppose they're quite occasional still. They're not that regular, but they're still quite sort of, it can last for an hour or two, sort of thing. I'm quite down and not really want to do anything.
Yeah, and that happens a couple of times a week? Or?
Yeah, it's not that regular. It's probably every other day, every few days, maybe something like that.
And what do you think about what you would do, or what your options are?
Yeah, that sometimes. Yeah.
And what have you thought your options are?
Just sort of running away or stabbing myself or something like that.
I think your unwell at the moment, and I do genuinely think that you will get better.
Yeah, yeah.
You know, I do have that hope.
Yeah.
You know,
Yeah.
that you are ill, and you know, I think we are getting you on the right track, and I think all credit to you because you put so much effort into getting better.
Yeah, thank you.
As well, you know.
Yeah.
And I think that you will have a fulfilling life again.
Yeah.
Mark is definitely someone who is doing his utmost to help himself, and when patients are really trying to help themselves, it does make our job much more easier, and they tend to respond better as well. Unfortunately, part of the problem with depression is that you sometimes lack that motivation and that drive. Are you still seeing the psychiatrist?
Yes, but I haven't seen him for about a month.
Okay, so there's that to do. I know we've got to sort your medication.
I just need some more. But I don't know if I need a higher dosage on the sertraline.
You know, in terms of safety, in terms of those suicidal thoughts, like if they get more common or you're taking them that bit further, then please let me know, let anyone here know.
Okay.
Go to A&E, because that's part of the illness, okay? And we wouldn't want you to do anything when you're not, you know, well.
Yes, yes.
You know, that has such serious consequences.
Yeah. Okay.
Yeah. Should we put a review on?
Yeah.
Let's do 4 weeks, because you'll have seen the psychiatrist by then, and
yes.
It'd be nice to know how the chronic fatigue referral is going through.
Yes, sure.
Okay? All right. How are you?
I'm so.
You've had lots of contact with your psychiatrist, haven't you? And I've had some with Vicky and...
I want to talk about that first of all. Hello, they had internal meetings, which I wasn't part of. I'm frustrated that they just don't seem to listen to me. Nobody is addressing the issues of what keeps me in the traumatic circle. Trauma, and you know, it's me trying to grab things that are there, like the sanctuary, like women's groups, things like that, and try and focus on moving forward. But my symptoms, my trauma, my flashbacks, my nightmares, my insecurities, my depression, my anxieties, this has not gone away.
Let me just try and see what they're trying to do about it. Say that you feel down and persecuted. So many different services, it's difficult to keep track of who does what and what you can expect. They also think that your expectations of services may be unrealistic.
Only expectations I have of services if somebody is offering me something, that it actually happens.
Yeah.
Because it's not happened. It's not happened. Okay, now I want to talk a little bit about the gender situation. Okay, I'm going back to Laurel's, right? I was told last time I had to wait 2 years to put the application in for the gender recognition certificate. So it's 2 years come now. But when I have to talk to both my psychiatrist there and you, because to go before the panel, I need my GP and I need the psychiatrist agreement letter. So, are you happy to do that?
I think you should talk to the Laurels first and go, because they will obviously know much more about that than me. But if they're saying that the situation is right for you, then yes, I will be able to confirm that.
The second thing, I'm in the position to go forward for surgery, for breast surgery, but the surgeon that I had the consultation with...
Because you've had a consultation?
I've had one consultation. Okay. She's now sent me away with 2 things that she will require from me. You know, I'm working on my weight loss anyway, and I'm consistently working on that. So that's part one thing. Good. And obviously the second thing would be my GP to say that they're happy for me to go ahead.
I don't see any problems with this, Valentine, OK? All right? So speak to the Laurels about both those things. OK, so we've got a plan there, all right?
Yeah, OK.
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 All right. OK.
Thank you.
Bye-bye now.
Okay,
bye-bye.
Yeah, bye.
Thank you.
Come and have a seat.
I've got like a sort of tremor in my left arm.
Yeah.
I've had for years.
Yeah.
And it's started seemingly getting a bit worse. So I just went out for food the other day, and when I was sort of trying to eat, it's a little bit now. When I was trying to eat, it was really starting to shake quite a bit.
Okay.
Sometimes, like, it's absolutely fine.
Yep.
But other times, it's really, I can't really put my finger on what it is that makes it happen. I think it might be possibly tiredness, maybe.
So you're 29 now. When did you first notice it?
I generally think I've had it for quite a few years.
Yeah.
I think, but it was so minor, I never really thought anything of it. But I think it's getting a bit worse.
You think it's a little bit worse? And what sort of work do you do?
I'm a physio.
Okay, okay. So what do you think?
Yeah, I know. So I'm trying to diagnose it myself, yeah.
Yeah.
One of the reasons getting it checked is my mum's got MS.
Right.
I've got no other symptoms, but I just thought
Yes.
probably worth flagging it up.
Yes. Do you want to just put your arms out like that for me? You have got this. It feels like you've got a fine tremor in both.
Yeah.
But it's more obvious on that side.
This is what it is always like.
Yeah.
But sometimes it really... The other day I was trying to eat some food and it was really like that. And I had to
Yes.
sort of put this hand down and
Yes.
it's really noticeable. I do have a shoulder problem on my left side, that's the only thing.
Right. The other things in my head of tremor can be from thyroid disorder. We should probably do some bloods and just check that.
Okay.
Can I get you to just do me one or two little things just to look at the cerebellar function? So hand like this. Okay, and now a bit faster. Okay, and then let's do it the other way around. So that hand down that one. Okay. Great. Okay. Next thing I want you to do is to touch your nose and touch my finger. Touch your nose, touch my finger.
Just I can feel it shaking a bit when I do that. Yeah, that's bringing it on, you know.
Okay.
It's like a sort of juddery.
Yeah. Okay. So that does seem to sort of exaggerate it.
Yeah.
Okay. Let's see you do that with that one.
I'd say very slightly, but yeah, doesn't seem.
Okay. Okay.
But that's definitely brought.
yeah.
That's what it feels like.
That's what it feels
when
like.
goes,
Okay.
yeah.
Okay. And you don't experience that in your legs.
No, not that I've ever
all?
noticed.
Your main worry is around MS.
I wouldn't even say worry, to
No.
be honest. There's just slightly increased chances.
Yeah.
I thought I'd bring it up. So
Yeah.
So if anything happens in the future, we can sort of say, right, okay, well, it started then.
So if we get some bloods done, and then to think about whether we want to ask neurology to see you just to check it out, do you think that you would favour that?
Yeah, that sounds like a plan.
Okay. Then why didn't I just do both those things? And then, as you say, it'll sort of lay it to rest, won't it?
Yeah.
Great.
Brilliant.
Okay.
Fine.
Great.
Thank you very
Nice
much.
to meet you.
See you.
Bye then.
Come on in. How are you doing?
Arm. I don't know what's going on. It's been like it since the beginning of March. I thought maybe I'd sort of muscle thing or anything, but I can only sort of move it so far.
Well, we can certainly have a look at that.
Right, okay.
Okay.
Okay, going up is fine. The side, and it goes that far.
And
then
whereabouts exactly is it painful?
it's
Just
like-
in the main...
Yeah, it's like, can't really pinpoint it, to
Is
be
it in
honest
the
with you.
elbow? Is it sore in here?
No,
And it's not sore when you move your forearm, it's sore when you move the top bit?
no.
That's okay?
Yeah,
Pull me in.
so I can feel something there.
Okay, and does it hurt as you go up the back, like doing your bra strap and stuff?
Yeah,
If you push me up here, does that hurt?
that does.
Okay. So that's the thing, that's the movement that brings it on.
is, yeah.
Just relax now. If I move it, is it less bad than when you move it?
Yeah, it's less bad.
It's less bad?
It's less bad.
Okay. It's good. So that helps me to figure out what's going on.
Oh, good.
So I think what you've done is injured one of the muscles around the shoulder that comes down into the back here. And it's called your infraspinatus muscle. And the reason I can tell that is because there's one movement that brings it on particularly, and that's pushing up against me here. And that is the muscle that's used to do that action and to move your arm around. The other thing that is making me sure that it's that is that when I move it, you're not having to use any of the muscles, obviously.
No.
And so, but it shows that there's nothing in the shoulder joint that's causing the problem. I think probably that this will just settle down with some time.
Yeah.
And I think that probably we're going to get away without needing to do any physio if it's not causing you too many problems. I would suggest that you try some ibuprofen 3 times a day, maybe up to a month, would help to settle that down. And then I'll see you again. And if it's still bad at that point, we'll get you some physio for it.
All right, okay.
Does that sound like a reasonable plan?
Sounds good.
So yeah, try that plan and just keep gently exercising. One of the things that you can do for your own physio is to put your arm out here and write the alphabet. So, okay, so you start off small, A, B, and if you just do small letters first, C, D, and then later on in the week, do it a bit bigger, A, and then by a couple of weeks' time, you can do really big letters.
Okay.
And then if you do the alphabet twice a day, morning and night, but just getting bigger and bigger letters, by the end you'll be doing huge ones.
Right, OK.
And that's quite a good way of just getting some of the physio done for your shoulder.
Right,
so
I will
do your own
that.
exercises with the ibuprofen.
Do my own,
And then we'll see you in a month's time if it's not settling down.
Good.
Have a seat. Thank you. Oh, dear. Right, that's a big sigh.
Oh, yes. I was here last Tuesday.
Right.
That's with a UTI.
Yeah.
So I've had it before, but
Right.
this time was different. It was so painful.
Right.
So I came to the doctor, and then she prescribed for me some antibiotics.
Yeah.
And then she said between 2 to 3 days it should begin to clear.
Yeah.
So today was the last time I took it.
Yeah.
But I still feel pains.
So the urine sample that actually went to the lab, it didn't grow an infection. OK.
OK.
So...
so what's it then?
Dr. Bolam did dip it and it did show white cells. So any discharge or anything down below?
No, not that I know.
No. Any new sexual partners at all?
No, it's only my husband.
Right, OK, OK. Could you do another urine sample for me now?
Yes, I can do that.
Saying that. Oh, one last bottle. If you go and do that and then come straight back in.
Right, I'll do that. Okay, thank you.
OK, brilliant, thank you.
I couldn't pee much because I did quite kill me.
Plenty, that's fine.
The sample that the doctor took, she asked me to call the lab to find out whether it's in. Are the results in?
Yeah, well, that's what I said,
okay.
that it's negative. When she dipped it, there were white cells in there and blood. Right, so there's 1+ of blood and 1+ of leukocytes again. So we'll send it off again. OK, if you jump on the bed, can I have a little feel of your tummy? Just pull this around. OK, so where's the pain?
Here.
Yeah. A little bit there. That's quite sore there, isn't it?
Yeah.
OK, you can pop your stuff on.
OK.
Most of the time, when we treat a urine infection, when we send it off to the lab, we would expect to grow bacteria. People can have infections in their urine or in their kidneys without it showing. OK. So I feel it's probably worth us treating you with some further antibiotics as you're still symptomatic. OK.
That's fine, thank you.
There we go. I hope things improve. Drink loads as well. Yeah.
Thank you.
OK, but if it doesn't get better, do come back.
Thanks.
OK, no problem. All the best. Bye-bye.
Thank you. Bye.
How have things been since we spoke on the phone?
Finally, my headache receded on Saturday.
Good.
But even just moving my head, everything felt totally bruised inside. And this swelling that I've been getting for years now is beyond a joke.
Yeah.
When I got up first thing in that morning, my head was like a football, where normally it swells from here. My whole face, I was so shocked when I looked in the mirror, it wasn't like me at all.
Tell me what things you think have been ruled out with it.
They ruled out, well, they were concerned about meningitis and possibly a hemorrhage, in the head.
But I think the headache has resolved now, so really it's the swelling issue that's the problem that you want to...
I've never had a headache like that in my life, ever. And I feel very, very unwell. I'm at the end of my...
Yeah. So I confess that I don't know what it's caused by, and we have discussed it a number of times before. And I know that you've discussed it with specialists as well, and in particular the specialists that know you best, which is the rheumatologist, because of both of your rheumatological problems. And so I don't know what would be next, to be honest, and I am aware that sometimes when that's the story, very occasionally I've missed something, and so have all the other doctors, and there is something that can be sorted out, but quite often we just don't know, and we never will know, and...
It's making my life absolutely miserable.
Yes.
On top of fibromyalgia and arthritis and everything, every other condition.
Yeah. Then there's kind of just trying to manage the problem,
That's what I've been trying to do that for years. I mean, that's why I've come to a point now where I've tried everything I can think of, but I'm nowhere further along the line, except I'm actually worse with it.
Yeah. So the other thing that we have done is you take a a water tablet.
Yes,
don't you?
every other day. Yeah.
Do you think on those days you're any better?
I actually think if I had them daily, I probably wouldn't have the problem of constantly going the entire wipe that day out. Yeah, I think that my body would balance better.
Well, I would be happy for you to try that out as a sort of trial of treatment, really.
Yeah, that's fine.
And
I don't want to stay on it if it doesn't work.
Because my feeling is that apart from moving your drugs around a bit to try and improve the problem, what I would like to be able to do is to try and make things easier for you.
Yes.
And that is, I think, our best option. How does that sound?
Yeah, that sounds sensible. There's one thing I wanted to ask you today.
Yeah.
I've been thinking about this for the last couple of years.
Yeah.
You know, I'm willing to take my medications and do whatever I can to make my life better.
Yeah.
However, I do not want to be resuscitated if anything should happen.
Right.
So could that be put on my notes?
Yes. So
I've spoken to my children about it.
Okay. So that's an interesting question. So normally we would have that kind of discussion if somebody had a life-threatening condition or they were very frail, which you don't really have either of those things. So you are neither very frail nor have a life-threatening condition.
I certainly don't look frail, but...
no, I think, you really don't look frail. We have a form that we fill in for that kind of thing.
Yeah.
Where we write down that we've discussed it with you, that you have agreed that's what you want. And then, so what we do is we then use that form and send that off to the ambulance service so that they know not to resuscitate you, otherwise somebody will call and you will be resuscitated.
That's right.
And that form needs to be with you, so it stays in your home.
But it's about quality of life for me.
Yes.
And my life is not a quality life.
No.
It's like being in a prison.
Yeah, well, it's very difficult. The request for DNR, do not resuscitate, was unexpected. There are protocols that we go through to make sure that we're making the right decision, that the patient is able to make the decision, and if not, we would convene a best interest meeting. I think that Julie Dawn's able to make that decision herself. But in this particular case, I decided I would have a think about it myself and also talk to some colleagues. Just going back to the water tablet thing, you only get 28 tablets at a time.
Yes, that's
Shall I
right.
change that so that you can be on them daily?
Yes.
Yeah?
Yeah.
And put that on repeat. All right, well, let's hope that you're right about the water tablets.
Yeah, I hope so. It would be lovely to have a simple answer, wouldn't it?
OK.
Yeah, can but try.
Yes.
All right, thanks very much. Yeah, that'd be
Okay,
fine. Thanks ever so much.
That's
Thank
all
you.
right. Bye now.
Bye-bye.
Come on in, have a seat.
All right, thank you.
I'm Dr. Graham.
Hi.
We haven't met before.
No.
You're a new patient here?
Yes.
Yes, you've moved from a local practice?
Northville.
Yeah. So what do you think are your main medical issues at the moment?
My breathing.
Yeah, sounds like it, doesn't it?
Struggling the last few days.
Right, so you've got COPD.
Yeah.
Yep. And any other, you've got diabetes.
Well, they think I have, but they think it might be to do with, because I'm on so many steroids.
Right, OK, well, we'll talk about that in a minute. And then, so you have, obviously, home oxygen.
Yeah.
You've got a high cholesterol, high blood pressure. You've had heart disease.
Yeah.
The steroids, what do you think you're on the steroids for?
That is for...
polymyalgia rheumatica.
I can't never say it.
You've got your cholesterol tablets, atorvastatin, yeah?
Yeah.
Candesartan for blood pressure. Then you've got the bone-protecting calcium vitamin D tablet. Lansoprazole for your stomach. Nebivolol, which is for your heart.
Yeah.
Sertraline, antidepressant, and spironolactone, which is sort of a water tablet. In your last practice, they decided that you do have diabetes.
Right, OK.
OK? Have you seen a practice nurse ever for a diabetes check?
I think I've got an appointment with one to see about it.
OK.
On the 8th.
Brilliant, yeah, you're seeing Mike.
Right,
and he's actually going to do a check of your heart disease, your diabetes and your COPD.
Shall I bring packed lunch? OK.
Bring a packed lunch, yeah, not a bad idea. So the bottom line is you've got a lot going on, haven't you? But it sounds like, to be honest, you're fairly on top of it. You kind of have quite a good understanding, I think, of what's going on.
Yes, I do understand.
Really, your heart scan suggests that you've got a little bit of heart failure, that your heart, normally it pumps like this, but it's sort of pumping like that. and that's why you need a bit of help with your fluid. Okay. So I'm your doctor.
Yeah.
And we have a system here where we try and get you to see your own doctor as much as possible. If it's a query, then you can book a telephone appointment and I'll call you back. I think we just need to get you to know you a bit.
Okay then, thank you.
Good.
Right.
Great. Nice to meet you.
Yes. Probably see you again.
Yes, I'm sure. Okay, bye now.
Thank you.
Well then, come on in. Come and have a seat. Hi.
I have some boils.
Right, okay.
Troubling me for some weeks now. I've tried putting magnesium sulfate onto them to bring them some surface, but nothing's really helped.
How long have you had those for?
They've been going on and off now for a couple of years.
Have they?
Yeah, I had a 7-headed one, 3.5, 4 years ago, on the bottom. That was very sore.
Yeah.
So that ended up having to be lanced. But I just seem to keep getting them. It's small when I shave.
Okay.
And it's not sore when I shave, it's normal. But
then you get boils afterwards.
Yeah,
Sounds like you've got an infection there. Should we have a look at it?
No,
Is
that's
it?
fine. That's fine. It's
Yeah.
Yeah.
But you're all right if we...
Yeah, no, it's fine. Okay.
Can I come in?
Yes. Sorry.
All right, gosh.
They're going all the way down and then
They're always just on the outside. They're not actually inside your bits.
They've been going down that way, yes. And I have some. I've had a few on my bottom as well. Oh, but they're so painful.
Yeah, I can see that they are. That's fine. Do get yourself dressed up and come on out. Okay, so those infections, those are little boils, as you say.
They are boils, aren't they?
Yeah, and
Okay.
they're essentially what's happened is when you shave, the
hair follicle goes down instead of up.
and you get a little bit of infection around the base of the hair follicle.
Why do they not want to come out?
Well, it's because of the shaving that sometimes then you get a tiny bit of skin growth over it, and it just means that it can trap some of the bugs in the hair follicle, and so it happens more commonly when you shave.
Right.
What we need to do is to try and reduce the amount of bacteria down there.
Right. What causes bacteria down there?
Well, it's actually we're all covered in bacteria all over our skin, everywhere. Some wash just to help reduce the bacteria there.
Dermal, well, when I wash.
Well, I'm going to try something that's a little different from that, just to see whether that helps settle it down. The other thing to do is to think about not shaving there, because obviously that will reduce the chance that you get the infection there.
There is that point.
And if you're getting other infections, or you're getting this as an ongoing thing, should we be doing any other tests? It's not unreasonable to check your blood test, as I say, and then we'll see what's happened when we've got the tests. You don't get any under your armpits or anywhere else?
No, I use a different type of razor. I use Bic for there and electric for there.
OK. Blood test you can book in as well, and then I'll see you with the result. All right?
Yeah.
All right. Cheers then.
Thanks, Dr. Pelly.
Bye-bye.
Bye, darling.